Damian Dati has first report on a summit convened by partners in Abuja.
Tuberculosis is an airborne bacterial infectious disease which affects the lungs and other parts of the body, and currently the world's most infectious deadly killer disease ahead of HIV, claiming 1.7 million lives annually. With Nigeria ranking 7th in the world and 2nd in Africa among the 30 countries with the highest burden of TB, there is a renewed effort to tackle the issue head-on. That explains the convention of this symposium, jointly held between the Stop TB Partnerships Nigeria and the Bingham University, to raise leaders that will be proactive in the fight against the disease.
Nigeria, including women and children, account for about 237,000 of these deaths. These are indeed needless deaths from a preventable and curable disease.
Our goal is to end TB in Nigeria, and we are committed to work together with academia and all stakeholders in ensuring that this is achieved. We are unwavering in our commitment.
The fact that Nigeria's case detection rate is 20%, which is one of the lowest in the world, the country has 80% infected cases roaming the community.
New infection every second. So if you imagine how long we've been here, and in terms of minutes, multiply that by 60, that's how many people have been infected.
As parliamentarians, we look at policy issues, we look at possible ways of intervening on policy measures that can end tuberculosis.
Bingham University, through its Zankli Research Center, is advancing knowledge and generating evidence in driving policy decision-making on the issue.
For instance, one of the research we are doing is good because we know that most patients go to the patent medicine vendors first before going anywhere else. So we went to the patent medicine vendors and we said, look, let us, anybody who has cough, okay, instead of just giving such person drug medicine or whatever, cough medicine, we train them to collect sputum samples from these people and they send them to our lab. And you know what? We get so many patients with TB from these people. We're also looking at new drugs that can improve the detection of TB.
The federal government, in collaboration with international organizations, have been able to provide the diagnostics, that is, the gene expert that we said can be used to diagnose TB just 2 hours, and then treatment. And this treatment is totally free. You don't have to pay anything. But remember, anyone that is coming 2 weeks or more should visit an health center.
The center offers free TB tests for the whole North Central Zone with state-of-the-art facilities.
Thank you, Mamso. Joining me in the studio for an appraisal of the Stop TB partnership in the country is the Executive Secretary, Mayowa Joel. Welcome to Health Options, Mr. Joel.
Thank you
for
having us here.
What would you say remains our weakest link, as a country?
Thank you very much. Once again, it's a great opportunity to be here on behalf of Stop TB Partnership Nigeria. Stop TB Partnership Nigeria is a multi-stakeholder partnership working to support and improve synergy among all stakeholders to end TB in Nigeria. As of today, over 1,000 members, all across the country, including organizations and institutions. When it comes to the challenge that we are facing with TB in Nigeria, it's multifaceted in many ways. First, the enormous of the challenge is that Nigeria is one of the 7 countries, just 7 countries that constitute 64% of the global burden for TB. But the uniqueness of Nigeria is that we are also 2nd in Africa with the highest burden of TB. And where our greatest link, 2 most important, or 3, let me put it, are the greatest weakness or the challenges that we are facing. Number 1 is the awareness. The awareness about TB is still very, very low. Number two is the diagnosis. We are still unable to find the number of TB cases we should. I'll give you an example. There are about over 400,000 TB cases in Nigeria. But it's only in 2017 we were able to notify or detect just over 100. So that is just 25%, about 25% of the total number of TB cases. That means there are over about 75% of cases that we are yet unable to find. And that means these are people...
What risks does that portend?
Exactly. That's where I'm going to. This means these are people who have TB, who are living anywhere in the country, and who are able to infect at least 20 other people per year. So that is the risk factor that we have. And the third weakest link or gap that we have in terms of TB control in Nigeria is the financing. The financing is still very, very low. I'll give you a good example. In 2017, for example, from the costed plan that was done for TB response, a total of about $336 million will be needed for that year alone. In that year, we were only able to mobilize 36% of that 336 million. And from that 36%, 9% is from the government, while the remaining 27% is from the donors. So there's still a huge gap of financing for TB, which is about 64%. And where the gaps are is both from the federal government and, of course, most importantly, also from the state and local government levels.
I'm aware that the partnership is at the forefront of galvanizing global action on TB at the national level. That's back home in the country.
Yes.
How are you doing? What are you doing towards achieving this? What sort of synergy do you have?
Thank you very much. In Nigeria, Stop TB Partnership Nigeria is focusing mainly on these three issues also that we have raised, especially to increase political awareness on TB. As you may be aware, because of the effort of Stop TB Partnership Nigeria, Her Excellency, the wife of the President, Mrs. Aisha Buhari, accepted to be the global TB champion and ambassador, both for Nigeria and the world. So right now, she's at the forefront for us in Nigeria and also all over the world to mobilize additional support for TB. And she's using her position to inform, educate, and mobilize all the first ladies in Nigeria and in Africa to be at the forefront of ending TB. In fact, there is a summit of the wives of the governors in Nigeria that will be meeting this month, specifically only on TB, and it is being convened by Her Excellency, the wife of the President. Another thing that Stop TB Partnership is doing is we are working with the parliamentarians, and we have been able to support parliamentarians to establish what we call the Nigerian Parliamentary TB Caucus. These are a group of parliamentarians from different committees that are interested and want to work together to end TB in Nigeria. This is an affiliate of the Global TB Caucus, Global Parliamentary TB Caucus, that is being chaired by Honorable Nick Abbott from the British Parliament and the Prime Minister of Health, Aaron Musoledi, the Minister of Health for South Africa. They are the ones heading the Global TB Caucus. And in Nigeria here, the chair, the coordinator of the Nigerian Parliamentary TB Caucus is Honorable David Obungadu, who is the chair of the House Committee on HIV, AIDS, TB and Malaria. So we are working through this, and another aspect we are working is with the private sectors to see how we can mobilize additional domestic resources to complement what the government and the donors are giving to TB. And there's been, we are getting a good positive response in these three key important areas of focus. Another important area where we are now engaging is creating awareness. working with the media and working with the young people to be able to create awareness on TB.
Okay, it's often said that tuberculosis is a disease that is associated with poverty. In view of the point you made earlier on, where you said there are people who mingle with others in the society, putting them at the risk of, contacting, TB, will it still be right to say that it's a disease that is associated with poverty?
In a way,
are you driving home this, this aspect in your awareness campaign?
Okay, thank you very much. You see, there is the aspect of the poverty and TB. However, TB does not only affect the poor. And it's very important to correct that misconception, because TB is airborne. It's not based on what you do. It's just simply based on the air you're breathing. And you can be in the first class, section of the plane. You can be in your AC car and still contract TB, because as long as there is air, as long as there's somebody there that has TB and coughs into the air, then no matter your class or your economic status. So that
underscores concerted efforts and the utmost political commitment.
Exactly.
Okay, so take us back to the summit that was held recently. What was it all about, and what do you seek to achieve?
Okay, it was actually a symposium that was organized by Stop TB Partnership in collaboration with Bingham University, which is based in Karu, Nasarawa State. And the goal of that is to raise future leaders to end TB in Nigeria. Previously, okay, let me start like this. Every year, there's what we call the World TB Day that takes place on the 24th of March. This year, the theme is Wanted Leaders to End TB.
Okay, so give us a little gritty of
So, based on that, we thought, okay, if we are going to end TB, it may not necessarily be in the generation of some of the leaders who have played very key role in ending TB. We need to mobilize the future leaders, because the battle to end TB is not what we can say that, oh, it's going to end in the next 10, 20 years. So, and that's why we need these young people who are still, in the university to begin to think of what they can do to end TB once they begin to be part of the society. And so the symposium was organized on that basis.
So in essence, you have a long-term and short-term goal.
Exactly.
For that symposium. Can you briefly just let us into what those goals are?
The short-term goal is to educate the young people, make them aware of the challenges and the epidemic of TB, and to strengthen their capacity on what they can do as young people. But the long-term goal is to begin to create in them that consciousness that TB still lives with us, and they have a part to play to end it. So in the future, wherever they find themselves, either as doctors, as lawyers, or as, social workers, they still have that consciousness that, oh, I have received a training on TB and I have a role to play
so
to end TB.
So they become food soldiers for TB campaign.
Exactly.
Okay, thank you so much, Mayor Joel, for coming on Health Options.
Thank you very much for having me.
Specialists treating infectious diseases have shown that extracts from Garcinia, cola, trees, seeds are able to effectively counteract the spread of the Ebola virus. More information on this if you join us on Our Nature's Corner.
Ebola virus disease is a trending case right now. As we all know, it is a big issue in the Democratic Republic of Congo. Nigerians travel a lot. Nigerians are highly mobile. From the experience of 2014, we need to be very careful. It is important to talk about it because prevention, we all know, is better than cure. So we must be careful what to do, and this prevention is purely on hygiene. It is, by the way, in Africa, 1 in every 3 cases in the hospital is usually as a result of an infectious disease. Therefore, infectious disease is a serious problem in this part of the world, and especially our country. And this is mostly due to our hygiene level. So people should know what to do and what not to do. Our biodiversity as a country is a gift to us, and to the extent that there is no problem, there's no ailment, there's no disease that we don't have the solution to it. And we, in our environment here, there are plants, and animal sources that we can actually do research and develop them into products for the cure of Ebola virus disease. I'm sure that we still remember that one of the most popular plant products that people talked about then was the bitter kola. If you remember the Professor Morrissey who issue on bitter kola when Ebola virus broke, because he did his work a long time ago, as far back as 1999, where and isolated some compounds that can actually destroy Ebola virus disease. Colaviron is one of those compounds, and so many other plants. There are so many plants that contain alkaloids, flavonoids, and anthocyanins that are available in our environment, and we do not need serious resources to develop these products into, so that, because we do not pray that we have Ebola outbreak in Nigeria again, but the truth is it is possible. So it is not prayer that prevents it. It's not prayer that brings it. It is that we should organize ourselves and be ready for any eventuality. At the National Institute for Pharmaceutical Research and Development, currently we have 2 products for the treatment and management of Ebola virus disease, and we are pursuing this vigorously right now. As soon as we get access to a BSL-4 facility, we shall be testing these products on in the lab.
Word of caution here. Ebola is one of the deadliest diseases on the planet and is extremely contagious. Those natural remedies should be considered in conjunction with quarantined medical care being overseen by trained professionals who have taken all safeguards to prevent the spread. Fasting can be a challenge for anyone, but it can be especially difficult for someone with diabetes. Any diabetic is expected to know that successful good sugar management relies on healthy meals eaten at regularly spaced intervals. So, what happens when one or more meals need to be skipped for religious reasons or because of a medical or dental procedure? Health Tips on this episode focuses on some general guidelines that can help when it comes to fasting with diabetes.
The advantage of fasting is that it increases the life expectancy of individual. It also prevents diseases, something like hypertension, and also cholesterol, and something to do with the heart, that is cardiovascular. Then at the same time, it is also prevent cancer. That is scientifically proven. People with diabetics are not allowed to fast scientifically. If they have insisted to fast, but they have to take some precautions to avoid complications. The blood sugar level, it fluctuates. Now, during fasting, the blood sugar level can be below 70. If it is tested and below 70, that very individual has to break that fasting immediately. Now, after the break, fasting. Now the blood sugar level would be elevated from hyperglycemia to hypoglycemia. Then it developed complications of dehydration, urinary tract infection. Besides some other vital organs such as kidneys, such as liver, such as heart, such as central nervous systems, will all these be affected. He has to have a regular blood sugar level testing frequently. How frequent? 4 times a day. Now, when it reaches maybe 30 milligram DL, then at that very time someone will become confused, disoriented, shaky. Appetite will increase. He has to eat something. What kind of thing that he or she will eat and drink? Carbohydrate. What kind of carbohydrate? A cup of orange juice or Coca-Cola. Within a minute or two, he will be rehabilitated. I will give you a typical example of myself because I'm fasting. But scientifically, I'm asked not to fast. Why I'm fasting? Because I'm using insulin pump. This is insulin pump. This is artificial pancreas. Pancreas is an abdominal cavity. So this one here is outside. You put it inside your pocket. Now it has a sensor called inlet. Now when the blood sugar level came down below 70, it will stop secretion of the insulin into the blood. So the blood sugar level will never ever decrease. It will stay as it is, and that is a lifesaver. And I've been using this one now for over 20 years. What about those people who would like to fast and then after breaking fast? Now you have to take a lot of fluid. Not juice that contain sugar. Now you are not expecting it to take at least 1 orange or 1 banana. What about it to take about 3 or 4 bananas at a time? You are getting yourself into big trouble. What kind of trouble? Hyperglycemia. Kunu has a lot of carbohydrate. Drastically, it will elevate the blood sugar level from 100 to 200 to 300 to 400 and it will lead to 500. That is coma. It will cause kind of a mental problem and stroke. And at the same time, it breaks into all the organs. Coca oat is a little bit better. Now, what about the amount of coca oat that you are expected to take? It should not be more than a cup.
That's why the glucometer must always be handy for effective monitoring of sugar level, and for those who can afford the insulin pump, it is all about safety. That brings us to the end of this week's edition of Health Options. You can watch the upload of this and other episodes and email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdallah. See you again.